Happy Friday, everybody. So I wanted to jump on real quick this evening before the weekend and talk to you a little bit about one of my favorite vitamins, and that is vitamin D. If you are catching this on the replay, thanks for watching. My name's Amanda Nyberg. I'm a registered dietitian specializing in bariatric and weight loss nutrition, and my goal is to enthusiastically empower people who want to get back on track with their health and wellness through weight loss. So tonight I wanted to talk a little bit about the sunshine vitamin, and that is vitamin D. So the reason why we call vitamin D the sunshine vitamin is because that's where we get it from. The sun helps to provide adequate sources of vitamin D in the body. But there is a significant epidemic of people that have a vitamin D deficiency. And it can actually wreak havoc on a lot of things in your body when that deficiency is significant. So today I wanted to talk to you a little bit about why vitamin D was so important, what it does, and how you can make sure that you're getting enough vitamin D in your body so that you feel the best. So vitamin D is a fat-soluble vitamin. And vitamin D's most vital role is the regulation of calcium and phosphorus, and it also helps to facilitate a healthy immune system. So we know that it does a lot of really important things in the body. Now, getting enough vitamin D is super important for normal growth of bones and teeth because it has such a huge role in calcium absorption. And then we also know that vitamin D can help you to fight off disease and infection. We know that it can help reduce depression, and we know that it can even boost your weight loss. So we love that. Anything that's going to help with weight loss is a good thing. So there's a lot of reasons why a lot of us are deficient in vitamin D. Some of it has to do with where we live. So again, vitamin D is all about sun exposure. So if you live really far in the north, you don't have the opportunity to be exposed to as much sun in order to produce enough vitamin D. So people in the north tend to have higher levels of vitamin D deficiency. Now, even people in the south can struggle with vitamin D deficiencies because we tend to use a lot of sunscreen. All right, so anytime that we put a barrier on our skin that's going to prevent the absorption of sun, it's going to affect vitamin D absorption. So over time, as we've been more concerned about skin cancer and skin health and things like that, we've used more sunscreen. And therefore, we're not getting enough vitamin D synthesis in the body. So the reduce of sunscreen. Also, the reduce of time outdoor. We just don't spend as much time in the sun as we used to. So the lower level of outdoor time can also promote vitamin D deficiencies. Living in big cities where the sun is not exposed as much, and even having darker skin, which is a little bit of a natural sunscreen, can all contribute to issues of vitamin D deficiencies. So making sure that you have adequate vitamin D levels is super important because a vitamin D deficiency leads to fatigue, aches, pains, joint pain, bone pain, and just kind of this sense of overall feeling of not feeling well. There's a lot of research out right now that's kind of linking a condition called fibromyalgia to simply a vitamin D deficiency. We see patients, clients that have symptoms of fibromyalgia. When we appropriately correct their vitamin D deficient, they feel so much better. So all of that kind of overall weakness and joint pain and bone pain could be associated to low vitamin D levels. Now, this is the deal. So vitamin D 5-10 years ago, we really weren't looking at it, we weren't supplementing it, we weren't treating it. But nowadays, your doctor hopefully is running that on your routine lab work. Who's getting their vitamin Ds checked routinely? Give me a thumbs up if that's the case for you. And we're doing that because vitamin D is very easy to correct. If you have low vitamin D levels, it's very easy to correct. Now, normal vitamin D levels are anywhere between about 30 and 100 micrograms per deciliter, okay? The problem is, so anything under 30, you need to be treated with really high doses of vitamin D. The problem is that in order to feel the best, you really need your D levels around 50 or 60. So if your D, which some people's D levels are 12 and 9, if your D is that low, one prescription dose may only get you to a 30, okay? So now that's normal, but you're still super low. You're not gonna feel good when your D levels are at 30. Again, we wanna get those and keep them at somewhere around 50 to 60. So the biggest issue with vitamin D deficiencies is that the dose to increase your D levels is really, really big. So for example, if your vitamin D levels are below 30, you're gonna need anywhere from 50 to 100 to 150,000 IUs of vitamin D a day. So this is one of the biggest issues. Right now, the recommended daily allowance for vitamin D is right around 400 IUs, okay? We know, clinicians know pretty much across the board that that number is grossly underestimated. We need far more IUs of vitamin D a day in order to maintain a healthy level, and even more so to increase to a healthy level. So ideally, you should be taking at least about 1,000, maybe even up to about 5,000 IUs a day to maintain a healthy level. But again, when your levels are really low, you're gonna need more of a prescription dose. You're gonna need the 25,000 IUs, the 50,000 IUs, the 75, the 150,000 IUs a week is what we work with. So I get really frustrated when I see a client that has really low D levels and their doctor goes and tells them to take 1,000 IUs of vitamin D. If your D is at a 9, 1,000 IUs is not gonna do anything for you. That physician should be appropriately treating that with a much higher dose. So I encourage you, if you've had low D levels in the past and you haven't been treated appropriately and you are chronically having these low D levels, you need to have a frank talk with your physician and see if a higher dose is going to be better for you. Obviously, the issue with high doses of vitamins is toxicity. And this is something that I've looked into a lot because when we were looking at testing D and then treating our clients, we were trying to figure out, well, you know, what's the toxicity, you know? And there's a lot of research out that just basically says that they have yet to been able to see any case of actual vitamin D toxicity. So that's the good news. I always tell my clients, you know, you really probably can't take too much D from over the counter. So if you're feeling overly tired, if you're fatigued, if you've been diagnosed with fibromyalgia and you have a lot of bone pain, general pain, weakness, maybe you're just having a hard time losing weight, you may consider looking at your vitamin D levels. It's a very simple test and it's very simple to correct. And most people feel so much better when they have adequate levels of vitamin D. Okay, guys, yes, so get your D, take your D. I prefer, or the body prefers, vitamin D3. So that's what I encourage my clients to take. Vitamin D3 is found everywhere. You can find it at any store. Vitamin D doses are anywhere between 1,000 to 2,000 to 5,000. Very easy to find. So think about increasing your D supplements. You may feel better. If you found this information beneficial, I encourage you to share below. I encourage you to give me some likes so I know you love it. Share with your friends and family, and hopefully they'll find the need to incorporate more D in their life. Super excited. I've got a new round of programs starting next Monday, not this coming Monday, a week from Monday. So if you're interested in getting on track with your health and wellness, if you want to learn cutting edge nutritional strategies to finally lose the weight, but more importantly, keep it off for good, sign up. You're going to love this program. I hope you guys have an amazing weekend, a wonderful Friday, and I look forward to talking to you soon. Thanks, everybody.